you will learn surface anatomy. Now what is surface anatomy? Can anybody tell me?
Sir, it is a type of marking, means anatomical marking on the surface of the skin of a human being.
Okay, almost quite near the focus. Actually, it is a surface projection of different anatomical structures on the body surface. Like you may get an artery, the projection of an artery, underlying vein, underlying nerve, or a gland, or its duct, and so and so. So it's a surface projection or of different anatomical structures on the body surface. So now in the head neck region, we can get so many structures, but all the structures are not in your, I can find there are so many structures like glabella, superciliary arch, hairline, zygoma, angle of mandible, so and so. But all the structures are not in your syllabus. So first write down the structures which are in your syllabus. First, the points. Write down the points which are included in your syllabus. That means isthmus of the thyroid gland. Isthmus of the thyroid gland. Number 2, anterior arch of cricoid cartilage. Number 3, tip of greater cornu of hyoid bone. Number 2, anterior arch of the cricoid cartilage. Number 3, tip of greater cornu of hyoid bone. Cornu of the hyoid bone. Number 4, thyroid eminence. Number 5 point, Nasion. Nasion, N-A-S-I-O-N. Nasion. Nasion. Okay. Number 6, bifurcation of common carotid artery. Bifurcation of common carotid artery. Number 7, tip of 7th cervical spine. Tip of 7th cervical spine. Tip of 7th cervical spine. Number 8, infraorbital foramen. Okay, these are the points. Now about the lines. Infraorbital foramen. Now about the lines. Number 1, right lobe of thyroid gland. Right lobe of thyroid gland. Number 2, duct of parotid gland. Duct of parotid gland. Number 3, right frontal ear sinus. Right frontal ear sinus. Number 4, spinal accessory nerve. You know that accessory nerve had two components. One is cranial accessory and another is spinal accessory. So spinal accessory nerve. Number 5, right common carotid artery. Number 6, right internal carotid artery. Number 7, facial artery in face. And number 8, internal jugular vein. Internal jugular vein. Already we can see the internal jugular vein. The first point, tell me, isthmus of the thyroid gland. How we can identify the isthmus of the thyroid gland? First, we can feel the symphysis menti. Then if we go straight below, we can find one bone, that is hyoid bone. Then we can get the prominens, that is the thyroid cartilage. Okay, angle of the thyroid cartilage or the thyroid prominens. Okay. Below the thyroid, we can get another cartilage prominent, that is the cricoid. That is also a very important surface marking. And if we go half inch below, we can, below this cricoid cartilage, we can feel the isthmus of the thyroid gland. We can feel the isthmus. Isthmus is a band, okay, which connects the two thyroid. We can feel the isthmus. Just below the cricoid, we can feel a fibrous structure. Okay, that is the isthmus of the thyroid gland. Okay. So, thyroid cartilage, below the thyroid cartilage, we can feel the cricoid cartilage. Below the cricoid, we can feel the isthmus of the thyroid gland. This isthmus of the thyroid gland actually remains over the second, third and fourth tracheal ring. So, if I press, I will press the trachea and the person is feeling that I am putting a pressure over the windpipe or the trachea. So this is the second, third and fourth. And it is how it is is drawn at this level, two parallel lines, half inch in diameter. The gap is half inch in between. And there is also, we can give two parallel lines like this. And we can remove the rest. This is the isthmus of the thyroid gland. Actually, thyroid gland has two lobes connected by this isthmus of the thyroid gland. Next point. You can see this is the isthmus. This is the isthmus of this is the thyroid cartilage. Below we are getting the cricoid, and here we are getting the isthmus of the thyroid gland. Next, cricoid cartilage, anterior arch. We can feel the thyroid cartilage, Adam's apple, thyroid prominens, which is very much prominent in male. Below that, we can feel another cartilage. We can feel another cartilage below the thyroid. এই দেখো থাইরয়েড ক্রিকয়েড এর এত সুন্দর ক্রিকয়েড আছে দেখতে পাচ্ছ না ফিল করো এটা একজন one by one. So that is anterior arch of the cricoid. So we can put a point like this. This is the anterior arch of the cricoid. So first we have to feel the thyroid cartilage. Below that we can get another cartilage. That is the arch of the cricoid cartilage. It has got anterior arch and posterior lamina. Okay, you can feel. So this is the thyroid cartilage, this is the cricoid cartilage, and this is okay, and over which we can get the isthmus of the thyroid gland. This is the tracheal rings. So this is the anterior arch of the cricoid cartilage. Okay, not much complicated, I think. Next. Tip of the greater cornu of the hyoid. If we try to throttle a person, what we will do? We will use these two fingers. Just below the symphysis menti, we can find one bone, that is the hyoid bone. And if we feel, it has got two cornu, and we can feel it with the thumb and the index finger or the middle finger, like this. Okay, on either side we can get, this is the hyoid bone, and if we go laterally we can feel the cartilage, the cornu, that is the cornu, greater cornu of the hyoid bone. তোমার এখানে পাবে, এই দেখো ফিল করে এখানে হাত টিপে দিও না আবার, দেখছো? দিস ইজ দা, পেয়েছো? দিস ইজ দা, এক এক করে, ডোন্ট গিভ প্রেসার। এই দেখো হালকা করে এখানে, এই দেখো ইভেন এটা পর্যন্ত পাওয়া যাচ্ছে, টিপ অফ দা গ্রেটার কর্নু এখানে আছে। So that is the tip of the greater cornu of the hyoid cartilage, and here this is the point. I can feel, and this is the point here. This is the point here. This is the tip of the greater cornu of the hyoid bone. Again I am repeating. Go below the symphysis menti, you can get a bone. That is the bone, means solid swelling. Below it we can find the hyoid bone. You can feel it has got the cornu, and if you go laterally you can feel the cornu ends in a pointed area. That is the tip of the greater cornu of the hyoid bone. And that is also a point at actually which shows the transverse process of the atlas. That also shows the transverse, that also corroborates with the transverse process of the atlas. Okay, that point. That point is also very important when we will draw spinal accessory nerve. Okay. That the same point is given here for spinal accessory nerve. আছে কি? না এটা ওটা নেই। না ওই যেটা গেটা কর্নুটা নেই। চলো নেক্সট, very prominent one. This is the thyroid eminence, which is well nicely in case of male, and also it is also a bit prominent in case of female. So we can put a point like this. So this is the thyroid eminence. What is the importance? In case of male, it is very much prominent. And we know the upper border of the thyroid cartilage is very important, because here there is a bifurcation of common carotid into external carotid and internal carotid. There is bifurcation of external and internal carotid. Okay. So upper border of the thyroid cartilage, at this level there is bifurcation. Rather, we can say another thing, that is the common carotid, which is we can put one point at the sternoclavicular joint and another point at the upper border of the thyroid cartilage, and join these 2 points. We will get common carotid artery. Common carotid artery bifurcates into the internal and external carotids. Internal and external carotid. So we can get, this is the thyroid eminence. Okay. So this is the upper border where we can get the bifurcation of common carotid artery. Next, Nasion, frontal bone, nasal bone, and in between we can get fronto-nasal. There is a suture. So, or we can say one depression at the root of the nose. We can get a depression, that depression point is Nasion. Nasion. What is the importance of the Nasion? We can get inion. Similarly, on the occipital bone, a prominent, bony prominence. And if we join these two, Nasion and inion, it forms one parameter. So we can, there is transverse and vertical diameters of the skull. Okay, we can calculate. So this is the Nasion. Next, bifurcation of common carotid artery, already you know. This is the upper border of the thyroid cartilage, and we can feel, and this is the sternocleidomastoid. So this point is the bifurcation of the common carotid artery. Here we can feel the pulsation of the common carotid artery. At the upper border of the thyroid cartilage and the anterior border of the sternocleidomastoid, if we put our thumb in between, we can feel the pulsation of common carotid. So bifurcation of the common carotid artery, that is at the level of upper border of the thyroid cartilage. We can feel the pulsation of that artery. So the common carotid artery bifurcates into upper border, but it bifurcates into two, in which at what level? That is the upper border of the thyroid cartilage. And what are the branches? Internal and external. So it bifurcates into internal and external common carotid artery. What are the branches of the internal carotid artery in the neck or face? What are the branches of internal carotid artery in the? There is no branch. There is no branch of internal carotid artery in neck. Okay. It passes through the temporal bone. There is a carotid canal. Okay. Cervical part, temporal part, petrous part of the temporal bone, that is the of the temporal bone. Then cavernous part, within the cavernous sinus, then intercerebral part. So there are 4 parts. What are the branches of the common carotid artery? What are the branches of external carotid arteries? What are the branches of the external carotid artery?
Ascending pharyngeal artery, superior thyroid artery, mandibular artery, occipital artery, facial artery.
Mandibular artery. Mandibular artery.
Sorry. Facial artery. Lingual artery.
Lingual artery. তারপরে ফেসিয়াল আর্টারি।
হ্যাঁ ওটা বলেছি।
তারপরে পেছন দিকে যাবে।
হ্যাঁ ওই অরিকুলোটেম্পোরাল ব্রাঞ্চ।
টেম্পোরাল নয়। অক্সিপিটাল আর্টারি।
ওটাও বলেছি।
অক্সিপিটাল রিজিয়নে। কানের পিছনে কে যাবে?
পস্টিরিয়র অরিকুলার আর্টারি।
তারপরে টার্মিনাল ব্রাঞ্চেস।
অত আর মনে নেই।
সুপারফিশিয়াল টেম্পোরাল এন্ড ম্যাক্সিলারি আর্টারি। যেটা তুমি ম্যান্ডিবুলার বলছো ওটা ম্যাক্সিলারি আর্টারি। So these are the branches. You can see the external and the internal carotid artery. You can see. So this is AB. There is a common carotid. B to C, BC external, and this is medially. That is the internal carotid artery. Okay. And internal carotid has got no branch. Tip of 7 cervical spine. Patient is asked to flex, or the person is asked to flex or his or her neck. We can feel the most prominent vertebra, the tip of the cervical vertebra, most prominent vertebra, or rather the tip of the vertebra, cervical vertebra. So this is the tip of the 7 cervical, which is called the এই যে রোগা মানুষ আছে, এই দেখো এটা হাত দিয়ে আমরা দূর থেকে দেখতে পাচ্ছি, এই জন্য কি করো, এই দেখো টিপ অফ দা 7 cervical spine, এই যে দেখো এখানে দেখতে পাচ্ছি, এই যে এর দূর থেকে দেখা যাচ্ছে, we can feel it, we can see and feel the tip of the 7 cervical spine, which is a vertebral prominence, which is also called the vertebral prominence. We can put a point here. Okay, next. So what is the importance? If we can identify this vertebra, So that is a C7. Then C8. C8. C7. Then the next vertebra is C8. C7 এর পর তো C8 vertebra হবে। C8 আছে না কি একটা? C5, C6, C7, C8, T1. So we can calculate the vertebra. Thoracic vertebra. Then we can also calculate the lumbar vertebra. If we know the C7, then from onwards we can ascend upwards and we can identify the previous vertebra or the rest of the vertebra. Infraorbital foramen. We can see this is the infraorbital foramen. This is the supraorbital foramen which we can feel in the medial 1/3 and lateral 2/3 at the junction of the upper border of the orbit. We can feel the supraorbital notch. Supraorbital notch here we can feel. Just bank opposite to it, we can get the infraorbital foramen. And this infraorbital foramen is at the level of medial 1/3 and lateral 2/3 of the line infraorbital margin. This is the infraorbital foramen. How much we can go? Just 1 centimeter below. 1 centimeter below this infraorbital margin, where at the junction of medial 1/3 and lateral 2/3 of the infraorbital margin. Okay. And we must know this is an area. This is the lateral 1/3 and medial 2/3. Here we can put an injection. We can put an injectable syringe needle, and we can reach the ciliary ganglia, and we can paralyze the ciliary ganglia there. Okay. But what is the importance of this infraorbital foramen? So how we can feel? This is supraorbital notch. We can feel just bank opposite. This is the infraorbital margin. From here, just go 1 centimeter below. This is the foramen. That is the infraorbital foramen. So this is the point where we can put a marking. That is the infraorbital foramen. What is the importance of this infraorbital foramen? এটাই পাচ্ছে না ফ্র্যাঙ্কফুট প্লেন। ফ্র্যাঙ্কফুট প্লেন, হ্যাঁ, suprameatal notch. So what is the importance of this infraorbital foramen? The maxillary nerve is continued as infraorbital nerve. We know there are 3 branches of trigeminal nerve. One is ophthalmic branch, one is maxillary branch, one is mandibular branch. So this maxillary branch comes out through this foramen as infraorbital nerve, and there it forms a plexus with a branch of the facial nerve, which is the infraorbital plexus. Maxillary nerve is a sensory nerve and facial nerve is a motor nerve basically. So there is a quick reflex response. Wherever a quick reflex response is needed, there is a communication between the sensory and the motor nerve. Okay. If I put a cotton wool in the eye, what will happen? There will be immediate blinking because the sensation is carried through the trigeminal nerve. Nasociliary nerve. We know this ophthalmic branch has got again frontal, lacrimal, and this frontal nerve has got again three branches: frontal, lacrimal, and nasociliary, which will enter into the eyeball and it will supply the cornea and everything. So nasociliary, there is sensory nerve, and there is a communication from there. Ultimately, trigeminal ganglia, and ultimately in the we know PONS, that means part of the 5, PONS, pons, part of the 5, O, that means 6, 7, 8, part of the 5, 5, 6, 7, 8, PONS, that means 5th cranial nerve, 6th cranial nerve, 7th cranial nerve, and 8th cranial nerve. There the nerve nuclei are present in the pons. 9, 10, 11, 12. MU, medulla, MUDULA. Just omit one L. 4 nerves. 9, 10, 11, 12. So in the pons, you will get the 5, 6, part of the 5, 6, 7, 8. So there is a response between the trigeminal nucleus and the facial nucleus. They are very close to each other to perform the reflex response. So immediate blinking is by the 7th cranial nerve. If I put a cotton wool, wisp of cotton wool, then there will be immediately closure of, that is a corneal reflex. Okay. Right lobe of the thyroid gland. Already we know we have failed the cricoid, then we got the isthmus of the thyroid gland. Here, over the 2nd, 3rd and 4th tracheal ring. Over the 2nd, 3rd and tracheal ring, we are getting the isthmus of the thyroid gland. Okay, we will put 2 points laterally. We know this is the thyroid cartilage, Adam's apple. At this level, we can find, if we go laterally, we can find the anterior border of the thyroid cartilage. Here we can put 1 point. Another point, this is lateral part of the lower lateral part of the isthmus. From here we can go 1.25 centimeter, that means ½ inch below, and laterally we can give another point. Okay, and we can join these 2 points like this. This is the isthmus. This is 1 point at the level of upper border of the thyroid cartilage and at the anterior border of the sternocleidomastoid. This is 1.25 centimeter below and lateral to the lower point of the cricoid cartilage. So if we join this, we can get a lobe. That is the lobe of the right or left lobe of the thyroid gland. So I am drawing. So similarly on the left side we can draw the lobe of the right lobe of the thyroid gland. So this is very important point, that is the upper border of the thyroid cartilage. Duct of parotid gland. We know this is the tragus. We can put a point just in front of the tragus. বাবা পয়েন্ট তো নয়, যেন বিরাট একটা কিছু পড়ে যাচ্ছে। পয়েন্ট না, পৃথিবীর দাগ পড়ে যাচ্ছে দেখো। Another point in between the nose and the upper border of the upper lip. Here we can put another point in between the nose and the upper border of the upper lip, and we can join these two with two lines. But we will remove these two. That means the medial and lateral 1/3, and we will keep only the middle 1/3 of this. Okay, and this will represent the parotid duct or Stensen's duct. It is 2.5 centimeter in length. Where it opens, you can appreciate it opens in the upper vestibule of the mouth, where ovara papilla, which is present just opposite to the second molar teeth. So it is present, it opens in the vestibule of the mouth, just opposite to the upper second molar teeth. Stensen duct, and one nerve is above, one nerve is below. Upper and lower deep buccal nerves, because buccal nerve has superficial and deep. Deep has got again upper and lower deep buccal nerves. And this is also very important for your OSP, parotid duct. And stone formation is very common in this duct. হয়ে গেছে পর না নেক্সট right frontal air sinus. One point is already you have covered, that is Nasion. Nasion এর থেকে how you will go 1 inch above or 2.5 centimeter above, put another point. You can feel the supraorbital margin, medial 1/3 and lateral 1/3. Just over that medial 1/3 and lateral 2/3, you just put another point. And join these three with, you will get a triangle, that is the frontal air sinus. Which frontal air sinus you can feel? Is a heart sign, triangle. So that is not properly developed at birth. This sinus is gradually develops. Okay, that is frontal air sinus. And we know the pneumatic bones. Pneumatic means, pneuma means air. These bones around the nose, they are called and around the nose we get the paranasal sinus, and these paranasal sinuses are present within different bones. So these bones are called pneumatic bones. They contain air. Generally this contains air, but when this air is replaced with fluid, okay, secretions, it is called sinusitis. So frontal air sinus, frontal air sinusitis. Similarly, the maxillary air sinusitis. ethmoidal sinusitis. Deep to another bone, there is deep-seated bone, that is the sphenoidal sinusitis. Next, spinal accessory nerve. We know tip of the greater cornu. I can feel tip of the greater cornu. There I can put one point. I can feel the sternocleidomastoid muscle. It has got anterior border. Okay. So in the upper 1/4 and lower 3/4, here of the anterior border, we can put another point. Upper 1/4 and lower 3/4. Okay. Of the anterior border of the sternocleidomastoid. Then this is the posterior border. In the posterior border, where I should put a point, upper 1/3 and lower upper 1/3 and lower 2/3. We can put another point. Another point we can feel. This is the trapezius muscle, and this is the clavicle. So 1.6 millimeter above the clavicle and over the anterior border of the trapezius. Here we can put another point, and we can join it with a single line that represents the spinal accessory nerve. So one point at the tip of the greater cornu of the hyoid bone, upper 1/3 and upper 1/4 and lower 3/4 of the anterior border of the sternocleidomastoid, upper 1/3 and lower 2/3 of the posterior border, another 6 millimeter above the clavicle at the anterior border of the trapezius, and join these 4 lines. তারপর right common carotid artery. Upper border of the thyroid cartilage. Okay. Anterior border of the sternocleidomastoid. So here we should put one point, that is the initial point, commencement point, starting point. Another point we can feel the what I am feeling, the neck of the mandible. Okay, at the neck of the mandible. Okay, and just in front we are getting, when I am opening, there is the neck of the mandible, and this is the coronoid process. So just in front we are getting the coronoid process. So here we can feel we can get the coronoid process. Okay, just over the coronoid process we can put another point, and we have to join these 2 points with 2 parallel lines. Sorry, এটা আমি হচ্ছে right internal carotid. রাইট কমন ক্যারোটিড বলছি, রাইট ইন্টারনাল ক্যারোটিড। ওকে, এটা প্রথমে জেনে নাও। রাইট কমন ক্যারোটিড তো মানে মানে ইয়ে, দ্যাট ইজ দ্য, this is the bifurcation and this is the continuation. This is the right internal carotid. Okay, right internal carotid. Ebar common carotid. One point at the sternoclavicular joint. One point at the sternoclavicular joint. এখানে একটা point. And at another point at the upper border of the thyroid cartilage. So we can put two lines. That is the common carotid, right common carotid artery. তারপর very very important, সব ভুলে গেলেও এটা যেন না ভুলো, that facial artery in the face. We have to feel the masseter muscle. How we can feel? We have to clean that jode chepo. We can feel the masseter muscle, and this is the junction between the mandible and the masseter muscle, at the lower border of the mandible and the anterior border of the masseter muscle. We have to put one point here. Okay, another point 1.25 centimeter away from the angle of the mouth, and the third point is at the medial canthus of the eye. Medial canthus of the eye. Join these 3 points with parallel lines. Join this first, second one with a tortuous line. এখানে নেই, আমরা এখানে একটা করুগেটেড তৈরি করি, বুঝেছো? এটা দিয়ে একটা করুগেটেড এরকম করে করে তৈরি করি, এটাকে করি, এরকম করি, আবার এরকম করি, এরকম করি, this corrugated lines. Okay, zigzag lines. Join these two and join with these two with a straight line. We form the facial artery. What are the branches of the facial artery in face? At least you have to say 1 or 2 branches. Superior labial, inferior labial, angular branch. Okay. Buccal branch, these are the branches. এই যে দেখো, facial artery is tortuous, whereas the facial vein is straight, because the vein is towards the axis of the temporomandibular joint, towards. So there is least strain and stress and strain over the vein. Or internal jugular vein. Last, এটাই শেষ. Internal jugular vein. Put a point over the ear lobule. এইখানে. Another point at the sternocleidomastoid, we know the 2 heads of the sternocleidomastoid muscle. Okay, we get the two heads of the sternocleidomastoid muscle. Okay. This is the clavicular head, the sternal head, and in between we can put another point. Okay. Towards the junction between the sternum and the clavicle. Okay. So here we can put another point in between two heads of the sternocleidomastoid muscle where it ends, and we have to join these two with parallel lines. That is the internal jugular vein. An internal jugular vein has two bulbs, one upper superior bulb and inferior bulb. Where it ends, internal jugular veins joins with the subclavian vein to form the brachiocephalic vein. Right brachiocephalic, left brachiocephalic joins to form the superior vena cava. Okay.